Hi guys, welcome to the Young and Sweet podcast channel. This is season 2, episode 3, and today, as you can all see, we are joined here with new faces. But I think we can start from me. Yes, my name is Nyiha from the Young and Sweet podcast.
Hi guys, karibuni tena. I'm Josephine.
Hi guys, my name is Paulette and I'm glad to be here.
Hello guys, my name is Bivon.
Hi everyone, my name is Gikonyo. Very pleased to be here.
Yes, karibuni sana and feel at home.
Thank you.
So as you all know, or for those who don't know, this is the Global Week of Action. So Mr. John will be telling us more about what Global Week of Action is, and also he's representing organization for non-communicable diseases known as NCD Alliance. So maybe Mr. John, you can tell us something, one or two things about NCD, NCDAK, and also GWA.
Okay, thank you very much. Let me start with NCDAK.
Okay.
That stands for the NCD Alliance of Kenya, which is the organization in Kenya that brings together all players and actors in the NCD space in the country. And they have also kindly facilitated this event today, and we are very grateful for that. Now, NCD stands for non-communicable diseases. These are diseases that you cannot get or be infected from one person to another. The Global Week for Action is a week that is set aside by the NCD Alliance movement, where we commemorate the need for better control of NCDs, better health financing to prevent NCDs. And the theme for this year is closing the care gap. And today I believe we are here to discuss how to close the care gap, particularly in a type 1 diabetes setting. And very pleased to join these champions from Young and Sweet.
Yes, karibu sana. Today feel young. Uko na young people here.
Hata mimi ni young.
Pia we ni young. So guys, as he has said, the theme for this year's for Global Week of Action is closing or bridging the care gap. And so kuna vitu mbili tatu zenye sometimes they are not going as what we as the patient would want to go. One of them is maybe inadequate information or current information or updated information. Unapata zile vitu zenye our grandma and our grandpas walikuwa naambiwa about diabetes, no bado kuna hosi wenye utaenda uambiwe the same things, yet tuko in the 21st century. So maybe Josephine unaweza tuambia one or two things enye una feel about the information should be updated, ama uko tu sawa nayo.
Yeah. So may have one problem, like there is information, but is this information standardized? Like ukienda Machakos ama uende Nairobi ama Kijabi, the nurses there ama the healthcare workers giving the type 1 information, the same information. Because me na feel like the information is not standardized. Kuna mahali the information yenye iko is updated, then in some areas unapata that information is not the same. Unapata like I meet a friend ako in a clinic at maybe Nyandarua for instance, namwambia whatever I'm being told up to my clinic, ananiambia hapana, that is not the same information. Unapata like maybe I'm told when storage of insulin, for example, like you store it in a refrigerator, and at nowadays we are told that you can keep the insulin at that room temperature of 30. Unaona? So but then you go to other area, unapata hadi ana improvise the refrigerator cause bado anafikiria lazima you put that insulin. Napata ameeka sijui wapi like
Kapamba
ameka maji, yes, like you know, see that information is not standardized. So mnaonelea aje Bivon, Paulette, because me I've realized the information is standardized.
As for me, I have also experienced the same. For example, when you're first going to be diagnosed, you will find a doctor who has not even taken enough tests to know whether you're type 1 or you're type 2. So they'll just start medicating you. Then you go to a different doctor to seek maybe a second opinion. And that doctor now tells you, you're not supposed to be on tablets, you're supposed to be on insulin. And they're still not telling you what is required to actually know which type you are. So you are newly diagnosed and everyone is confusing.
It's like they have the information, yes, but imefika 70%.
Yes.
Kuna ka 20% inabaki mahali.
So they leave you with a lot of confusion, and you're left wondering, which doctor should I listen to? And you're left wondering, so I have diabetes, but I don't even know how to maneuver this. I think the information should be subsidized to all the doctors and nurses.
Hapo kwa tuseme kama storage, what you have described here, what I'm asking myself is, what has changed with insulin so that now it can be stored in not in a fridge but in room temperature? And is that information in the leaflet that comes with the drugs, and is it universal? Is our insulins now capable of being stored in room temperature?
Yes, what we actually mean is kitambo watu walikuwa wanajua kama hauna fridge then hauwezi tumia insulin.
Actually that's what I know.
That's
today.
what you know.
Yeah.
Yes, but nowadays with more information coming up na watu ku expound on insulin education, insulin therapy imejulikana, and if una store insulin yako kwenye hakuna joto, mbona words zinapotea kwenye hakuna joto mingi, then your insulin will be okay.
Mimi nauliza hiyo ni ile insulin ilikuwa inawekwa kwa fridge, you know, ama ile insulin mpya new formula?
What happens ni when you get a vial, before you open it, kama ujifungua inafaa kukaa kwa fridge. Sawa. Yeah. But when you open it, it's not a must to store it. And then unaona in African setup na our economy, not everyone can afford a fridge. Yeah. Sasa mtu ako Turkana hata tumia insulin juu ana fridge. No. Okay. And I have type 1s there, so that's what happened. And you find it hata kwa your packaging, it's written, it's stored under.
I think I understand what John is asking. John anauliza kama ile insulin ilikuwa inatumika back,
ile inakuwa kwa fridge bado ndio iko, ama hii ni insulin mpya.
Perspective to really change. Like watu walifanya research wakaona hii insulin si lazima ikue
kwa fridge.
Okay. Alafu unajua kuna
venye mimi na understand, unaona insulin ina depend unaishi wapi. So unaona venye Josephine amesema kuna mtu anaishi Turkana na kuna mtu ako Nairobi. So at least
room temperature Turkana na room temperature.
Alafu unaona nowadays hata in business come up with something, lazima ulize nini the person unatengenezea hiyo kitu, what, like, is it going to be suitable for them, like in Africa. So what happened me, I guess when they were coming up with this commodity, waliambia what, like, inaitwaje, our opinions, like, you know, we talk about patient engagement and involvement. Unanitengeneza hii kitu, will it be beneficial na kila kitu. So in Africa they were told like whatever, not everyone
we are not comfortable with insulin that requires refrigeration because we don't have fridges in Kenya, so many other places.
And from there wakakama kuna si lazima mweke kwa fridge, unaweza eka kwa room temperature ama ufunge na pamba.
Then I think that is something that people need to be educated about.
Yes.
Then I don't know whether you guys did some experiments in school. We used to make fridges with charcoal and things like that.
Actually, I used to use that when we were high school.
So is that still an option today?
Yes, it is.
For someone who is in a probably very warm setting, where room temperature means completely different, like from the room we are in here.
Yeah.
Okay.
Actually, hiyo ni kitu tulipi. Like me, I was, you know, I've stayed long with type 1. So nikiwa secondary, bado tulikuwa tunatumia the other information. I had a kapot. Nyungu tu hapo. Alafu nimepaka pamba na spirit, alafu naeka dawa naeka chini ya bed. Like that gave me a lot of stigmatization. Watu walikuwa wanashindwa hii ni uchawi.
Walikuwa ni witchcraft.
Yes.
Me attention to uchawi juu ya hiyo, but anyway, tulimongelea hiyo that topic of how to store your insulin kwa episode in season 1, maybe unaweza pitia hapo ukiangalia. So another thing I realized in the diabetic setup or in the diabetic sector, kuna ukienda clinic mostly, okay, let me not specify, but ukienda clinic unakuta ule daktari mwenye alikuwa anakuona kwa general side ndio bado ako kwa diabetes clinic. Like hadi unajiuliza wait, amesomea general practitioner na bado anakuja kwa diabetes clinic. So I felt like there's need to have more specialists, more diabetologists in this sector badala ya kumix. Ule daktari wa general ndo amekuona, maybe pia hajafundishwa about diabetes, but still he or she is the one advising you. Pia utakuwa insecure in terms of Kenya ananiambia iko sawa. So maybe before
out of experience nili travel nikaenda coast na nikagonjwa. So when nilienda hospitali I got a CO. Information yote alikuwa ananipatia ni wrong kulingana na information mimi napatiwa kwa clinic mahali penye naenda. So the only thing yote aliniambia kama atuelewani juu ajui anything about insulin, ajui about diabetic type 1, yeye anajua tu dispense drugs peke yake. Na mimi nimekuja naomba nataka nisaidie. So the only thing alikuwa ananiambia, you either listen to me when nakwambia am when utafute a qualified physician which hakuna.
Sasa mwanzo catch my feelings tunakwambia ukweli.
Okay, wacha ni explain hapo kidogo. Unajua training ya daktari ni hiyo unaita general. So you're trained as a general physician.
Okay.
Then now doctors specialize. Mtu ana specialize diabetes, cancer, cardiovascular diseases. So if you find a doctor in the general section and then they come to the diabetes section, it doesn't mean that this is a general doctor who came to do diabetes. No, it's a diabetes doctor who had been taken to the general area.
Oh.
Yeah.
So to your mentality,
yeah. So don't think that because you saw a doctor in the general section, they are not specialists. No. So all So what I mean is not all doctors are specialists in any particular, but all doctors have got training in general management of health. So a specialist can be in the general area if there is a need for that at that moment, but it doesn't mean that he's not a specialist when you see him on
no, our issue side. Is huyu mwenye haja specialize na diabetes kwa diabetes clinic
no, that one that is a different, that's an issue because you need to see a specialist and it's not just diabetes, all conditions you should be handled by a specialist. And a doctor should be candid enough to refer you to one if they are not specialized in the area where you are suffering at that.
Meskia, the wise man has spoken. That you should refer your patient.
But ukiona setup ya clinic zetu venye zinaendelea, most watu wenye wanatuona ni CEOs, ndio?
Sasa CEO ni nini?
Watu
wa huko nje wajui CEO. Nafikiri ni mkubwa wa DO.
But me, I'm thinking like, okay, they are specialists, but you don't find them kwa easy level. Maybe if you need a specialist, you need to go to level 5 ama level 6. But level 4 and level 3, zenye tunaenda, you don't find them. Maybe we can tell our policy makers ama wenye wako in charge ama the human resource management ya hospitali, like, is there days, because that ukienda Kenyatta, utakuwa unaona there is one general clinic where you see specialist, then the others zile TSA zile after 3 months unaenda unaona huyo CEO.
Okay.
So maybe in all hospitals at least maybe tunaweza kuanga na specialist because when you wanaenda after those 6 months ama yearly, cause pia tukisema sisi wote tutaenda Kenyatta queue itakuwa mrefu.
No, we shouldn't do that. Now, let us remind ourselves the theme for this Global Week for Action is bridging the care gap. So, are we saying that is a gap? There's a gap of specialists.
Yes.
At which level? Level what? Level 3, level 4?
Yes.
Level 3 and level 4.
Yes.
So, where are you finding the specialists? Level 5?
Level 5,
Level
yes.
5.
Na special
Na level
na
6.
Na level 6.
And private
Okay.
clinic.
So the ile gap tunataka kumaliza hapo ni specialist wakuwe devolved mpaka level 1, level 2,
Yes.
so that you don't have to all go and crowd out in level 5s and level 6. Okay, so that's a gap that needs to be
That's
closed.
a gap. That's a gap.
Okay.
Yes, on to another thing. Leo ni kwa dina notes watu wangu because it's very serious. Anyway, another thing is another gap yenye tunaona ni, can you imagine you're going to the hospital with all the diabetes signs and symptoms, and then what happens, unaambiwa utakuwa ukikunywa maji ndio maana you are being thirsty, when ni mzembe ndio maana you are lazy, ndio maana una feel you are tired all the time. So there's something called misdiagnosis, and in this global week of action, what do you say it? Naongea na mkono sasa.
Encourage.
Yes. Ama to advise the policy makers to help or to inject more resources for the medics information ya kupatia watu proper diagnosis. Usiende uko na symptoms za diabetes, unaambiwa uko type 2 na labda uko type 1, uko type 1 na labda unaambiwa uko type 2, because kuna watu wengi sana wanatumia tablets huku nje and wako type 1. So unapata mtu amekufa na DKA, ama unapata mtu alienda hypo and ajui what's happening. So I feel like misdiagnosis is a gap that needs to be addressed.
Okay.
Yes, kizungu inapotea kidogo. So maybe Mr. John,
Well, misdiagnosis is a global problem.
It's a global
Yeah, it's not just here. Even in developed countries, there is misdiagnosis, and a lot of symptoms are similar. But you can also tie it in with the lack of specialists in the lower cadre levels of hospitals. So we would like the government, and when we talk government here ni both, unajua sasa kuna national government na county government na health is devolved.
Yes.
So tunaita serikali zote wa make sure ya kwamba kuna specialists, na pia hao specialists wawezeshwe kupata refresher courses, because we are in a dynamic world, things are changing, treatments options are changing, information is changing, so that they are upbeat with what is going on currently. Na our specialists wakuwe kwa levels za chini, so that even the patients who are going to those levels wako able kupata ile information ambayo ni ya kisasa na ni halali.
Yes.
Yeah.
I agree. Na sasa kuna hii test nilisikia iko ya kujua kama ya type 1 ama ya type 2. Umesikia? Kuna mtu amesikia mahali?
Hata mimi nimesikia.
I think
Kuna hiyo
Test, yeah.
Just
Na Paulette ndio alikuwa ananiambia.
mimi nimefanyiwa when I went for my second opinion to really determine whether I truly have diabetes and what type it is. I think there is a certain test they did, but I cannot remember because I was not even interested to know that I have diabetes at that moment.
Ile test mimi nasikiaga sana na watu wa diabetes ni ile inaitwa HB1C.
Hiyo ni ya
Hiyo ni ya gani?
Ya kudetermine 3 months. How is it?
Does it apply to both type 1 and type 2?
Yeah.
Okay.
But there is this one.
Yeah, there is that.
But there's this
But
one.
I heard like the test kitu inafanya ni inaangalia your pancreas kama ina produce. Unajua type 2s they have insulin, but there's either resistant or the cells are not sensitive. Then there's type 1, they don't have beta cells, they are destroyed. So jambo ilifanywa hiyo, it's the same test.
It's that one actually.
Because after that is when I was given the insulin. So yes, I think that's when that's the test that was done.
So
But now
let me ask, daktari, kama hujafanyia test uweze weka kwa insulin?
Kwa sababu
Sina
pia
kuna different
breaking down to insulin, we are all on different types of insulin. So there's also something that determines, like your weight and other things that determines why are you on Mixtard and I'm on low rapid.
So maana tunasema the healthcare practitioners wanafaa kuwa equipped with adequate information and updated information. Tunasema quality information.
But now, sasa kuna point nyingine mmeleta hapo. You're saying you're on different types of insulin because your conditions, the condition affects you differently.
Yes.
Haya, sasa turudi pale kwa standard information. Now, I would think one of the reasons the information differs is because similarly, the condition is affecting you differently. So just the same way you are on different insulins, and I'm not saying, I'm supposing, the same way uko kwa insulin A na we wako insulin B na yule insulin C, is this probably the same reason you have been given information A, information B, and information C. That be a fair statement.
Okay, I'm thinking for management, information should be standard. But
For management, yes.
Yeah, but when it comes to treatments in terms
But
of
you see,
drugs,
management, if you have different, if you are being affected differently by the condition, let's talk about information kama ya diet, for example. Don't you think that probably that's the reason why ile information wewe ulipata ni tofauti na ile mimi nilipata?
No, actually what we mean, equal standard in a way that for the basic problems.
Yeah, basic
Problems. Kama ni type 1, regardless of Kenya ataambiwa na the dietitian ama Kenya ataambiwa na the diabetologist, insulin atatumia. As long as you're type 1, tumia insulin. That's what we mean by standard.
Okay.
Standard.
That is standard, but now,
yes.
tumesema kuna insulin A na insulin B.
There are so many types.
So, if I hear that Josephine is on insulin B and I'm insulin D, I shouldn't think that mine was as misdiagnosis.
No.
Good.
but then remember pia the insulins you're using ina depend na mfuko.
Yes.
Because most of them depends where umeenda na mfuko. Because unaelewa there ni kama ni
So, is the difference in brands or types?
brands.
Ni brand.
And also
Insulin is insulin.
also how they work.
And how they work.
Because some
Yeah,
people
then that
can
is
put
type.
on a certain type of insulin and their sugars don't go down, and someone else can be given a certain type of insulin and their sugars keep going low.
Yeah,
So
it's like
to the type.
it's like hypertension.
Yeah.
With
yeah.
There are like
And
a
how
million
you-
drugs for
And also how
hypertension.
your body responds
Yeah.
to the insulin.
Yeah.
So I think the information should be standardized so that the practitioners avoid putting you on the wrong insulin.
Sasa hapo ndio hatushikani, and I
Oh,
don't want
but
us
no
to dwell so
insulin.
much
Scratch that.
because
Because
as long as we are being affected differently and we are responding differently to treatment, there is no way the information is going to be standard, because we utaambiwa utumie one type of insulin because that's the one working for you, na mimi nitaambiwa nitumie another type. We utaambiwa usikule githeri because of that, or because of the medication you are using, mimi naambiwa githeri nikule. Unaona? So up to that point, maybe the information cannot be standard because of what I've described. And I know this. I know this because I'm also in a patient group
but I've
where
seen
we.
this, This different na patient mwenye ameenda kwa public hospital
Exactly.
na mwenye ameenda private hospital.
Okay.
So unapata ule mwenye ameenda private hospital amewekewa on most hata zinakuanga high dose, si ndio?
not high dose.
Nasikia kuwakata. Because this
That's a
conversation-
whole topic.
Yeah.
That's a whole other
But
thing.
then to end up, there's something when we talk about care, tunasahau even at home. We are talking about this information, wrong diagnosis. But do you know everyone needs to be aware? We create awareness of type 1. Such that hata nikienda hospitali and I know the sense and I know risk factors of nini zenye zinaweza risk factors, like it's genetic. So if you have someone kwenyu diabetic and you start experiencing these types of symptoms, you might be. So hata nikienda hapo niambiwe ni malaria nini, I can request nimwambia, can I do this test to determine if I'm diabetic, because I think this and this. because that can also save time. Because hata huko interior huko ndani ukienda usimame, jina ni Josephine, niko mgonjwa wa kisukari, kila mtu alikuwa wewe ni mdogo uko na sukari. Like
that takes us back to quality information. If you have information, then utajua pia the signs and symptoms that I'm having inaweza kwa ABCD. And to wrap it up for standardized healthcare management, tunasema atusemi insulin A ama insulin B won't work. Tunasema information ikweka patient ni type 1 hata kwa on insulin kila mahali. Kama patient ni type 2 then hata atumie medication zake zenye anatumia. And before I go to the next point, please kindly remember to subscribe, like, share and comment on our YouTube channel, that is the Young and Sweet Podcast, Facebook, TikTok, Instagram, wapi kwingine? Twitter ni X kote Young and Sweet Podcast, if I'm not wrong. And then because it's Global Week of Action, kindly if you comment or post anything about non-communicable diseases, kindly remember to put the hashtag GWA, that is Global Week of Action. And also we'll be tagging NCDAC, NCD Alliance, NCD Kenya Alliance.
Kuna hashtag nyingine hapo ya hashtag the moment for caring.
Moment for caring. Yeah. Hashtag bridging the care gap.
Yeah.
And then, so to wrap it up, this thing called UHC, Universal Health Coverage. So here cover in this sector kwa ya non-communicable diseases. Kila siku utasikia asubuhi na jioni utasikia. So universal health coverage inamaanisha mtu mwenye anaishi in a low income home and mtu mwenye anaishi in a high income home, wote wanapata the same health benefits. Kama huyo anapata 220 NHIF ya kumcover for surgery, pia ule mwenye ako Kibra, Mathare, Dandora uko chini huko pia anapata the same thing. I don't know if kuna mtu anataka kuchangia because inakuanga very hot topic. Let me just start with Mr. Gikonyo because he and are passionate about this. Okay. And maybe you can talk one or two things about it.
Yeah, so UHC ama universal health coverage means that all persons, rich, poor, short, tall, should get the same health service or the health service that they require of good quality, in good time, without having to wait for too long, and without going in catastrophic financial expenditure. Sure. Without having to sell their properties, their land, everything to finance the treatment. That's what UHC means. And I'm excited about this because UHC was started by what we call the United Nations High Level meeting, which happened in 2018. That is when actually the term UHC was first pronounced. And this week on Thursday, yes, there is another United Nations High Level meeting in New York, and we know that our president will be there, and we would like to call upon him to commit to the commitments that were made in 2018 on UHC, like I have described, and also to have the political statements that will be made in this United Nations High Level meeting to make sure that UHC is now fully rolled out in Kenya so that we can start enjoying those benefits. We know since the pilot stage in 2018 where we had pilots in Kisumu, Machakos, Nyeri and Isiolo counties, we have not seen all we have had is false starts with UHC. It hasn't really worked for us. But if you look at the Kenya Kwanza healthcare plan, they have started some very important moves. For example, they are focusing more on prevention, which is a core component of UHC. Because the current model in Kenya of treatment or healthcare is that we wait for people to get sick, we wait for them in hospitals, and then when they come, there are so many, we can't help them. But if we go to prevention, then we are going to prevent a lot of people from getting sick. And those who we can prevent, because people still get sick, we prevent them from getting complications of their conditions. For example, now when you're living with diabetes type 1 or type 2, there's risk of complications like stroke and kidney failure. Kidney failure is very expensive to treat. For example, it's costing us $1 million shillings per year per patient. That is money that we can save and be able to save other lives by making sure that the person who has diabetes, the person who has hypertension, does not get the complication of kidney failure or stroke or any other complication, which becomes more expensive to treat. So it's good that the government is planning to go into prevention. They're planning to bring us about, I think, 10,000 healthcare workers who will be deployed across the country. The original figure I had earlier was 90,000. Now I saw recently 10,000. But whichever number we start with, tutashukuru.
Mr. President.
Tutashukuru because tukifika hapo tukianza tu na tuanze vizuri pole na tuzuie watu kugonjeka, then UHC will start working for us. Na pia niongeza ya kwamba the biggest challenge ya UHC ni funding. Yeah, hakuna pesa. So wakati tunaambiwa to join NHIF for example, unajua watu join NHIF sasa ile umegonjeka, unaenda unatibiwa, ukipona unatoka. So what will happen to the next person who gets sick and does that? Eventually that money will run out. So the idea to make NHIF into a social health fund so that we all contribute to take care of those who get sick. Na mtu asisikia ati unajua nilipa NHIF whole year na sikugonjeka. Asikutumia. Sasa ungetaka ugonjeke ndio utumie pesa yako. No, so we should also be proud that even though I did not use my contribution, help a child somewhere, helped a pregnant mother somewhere, help diabetic.
So on that healthcare coverage, universal healthcare coverage, I would say, in as much as we are trying to prevent some diseases from happening, for us, like for type 1s, hakuna to prevent type 1s, it's an autoimmune disease. So what we say is we would like to get at least this medical supplies, tukienda clinic, everything is covered for.
Yeah.
Because now we can't prevent it from happening, it just comes. Tunajikuta tu.
Alafu pia, like, when we talk about UHC, there is no funding. You know, a challenge that we are facing in Kenya is corruption. So people are not accountable. Yes, it can be funded, but I think like if accountability can be included in governing UHC, where check and balance, it's one item which will be essential, and people, because you find like it can be funded, but corruption in Kenya, like we don't know even if person inanga wapi. Nasikia like maybe a certain county was allocated this amount of money, alafu there's nothing that was done, kulikuwa kununuliwa ambulance sijui nini, like I guess our government needs to have accountability, where allocation of resources is equal in all, so that we are able to,
especially in the NCD sector. So
I guess accountability and corruption equal first fight in health in department.
Sometimes that haikuwagi corruption. You see, accountability is saying we received X amount of money and this is how we spent it. So if the government is not saying that, whether it's national or country, then I don't know how they spent my money. So it could even be that gap of information. Maybe the money was put to good use, but because there is no one who is accountable enough to, ni kama vile tunafanyaga mchango, ati tunachanga kwa shughuli fulani. So nataka kuona hii pesa ilitumika hivi, na tulitumia mtu tulichangia ama shughuli tulichangia ilifanyika. Same thing with government. The government should be accountable enough to explain to the citizens that this is how the money was spent. Yes.
So Mr. President, tunakutambua, tunakupenda, please do something to
us. Mambo ni matatu.
Yes, guys, as we wrap up, najua nimesema hivyo a while back, lakini today is a very important day to all the patients. Today is World Safety Patients Day.
World Patient Safety Day.
World Patient Safety Day, yes. And So maybe nani atatuambia what that is before?
Anza kuongea jako na point. Anataka kusema.
Tukimalizia.
Yeah, kituambia what it is.
Okay, what is all about World Safety Day? So, World Safety Day means
patient.
Patient Day.
World Patient Safety Day.
Okay, World Patient Safety Day. It's all about bitongelea side our rights as kama patients or to type 1 diabetic type 1 services zenye inafaa tupatiwe tukienda kwa hospitali and all that the government should require all that the government should require about taking care of the patients in the hospital and the whole process. That's what I can understand about it.
Okay.
I will just go back to the first point that we made about information. When the healthcare workers have enough information, they will be able to take care of the nurses. They'll be able to take care of the patients vizuri. So yeah, I will emphasize on information and quality trainings of healthcare workers.
Nice. Josie.
So me, when I hear about what patient safety day, I mean we are talking about either in hospital, at home, in whichever setting unaenda, even in school, because nilikuwa mgonjwa and I had insulin at school. So when you are talking about safety, I mean safety of patient in all surrounding, and whatever medication and services we are getting, they will not cause more harm. Because we are using this to make us well. Because I'm using us, and everyone is a potential patient. Either mgonjwa saa
even the people behind the scenes.
Everyone is a potential.
Our rights.
Yes,
rights
our
as a
rights.
patient.
But quantity and quality healthcare in terms of medication, supplies, and services.
Okay.
Mr. John, ukitufungia hiyo topic.
Okay, thank you. World Patients Safety Day is a day that we focus on the safety of the patient, and it's commemorated every year on the 17th of September, like today. And basically what it's about is that a patient should be able to get the health service they require without getting harmed. And like Josephine has said, it's safety at the hospital, in the hospital setting. It is safety at home, or it is safety at whatever place that you are a patient. So we should try to make the world we live in a safe space for patients. But
all patients.
Yes, for all patients. But in particular now, since most patients go to hospitals, and hospital is probably one area where there is a lot of potential for harm. But we would also like to remind everyone that it's a shared responsibility. It's not just the doctors who should worry about patient safety. It's not just the patients, a shared responsibility. The theme for this year is engaging patients in patient safety, because there is an important role patients, their caregivers and their families can play in enhancing and ensuring that the patient is safe. Now, how can a patient get harmed? Probably at home. And I think we have mentioned some of those areas, like improper storage of medication. Then that improperly stored medication can harm you, or directly or indirectly if the efficacy is affected, and so you are taking a drug which is not working and you don't know because it's not properly stored. Storing children medicines out of reach of children, for example, that's a safety issue. Mtoto anaweza kukamata dawa ambazo nafikiria ni sweet atumia na kukuwe na hali ya dharura. What else can happen at home? Overdose. Now, how do people overdose at home? Umekunywa dawa saa 2.
Itafanya kazi.
Saa 5 umesahau kama ulikunywa.
It happens.
Yes, happens a lot. So, what do? Unakaa unaona sasa kutokunywa ni mbaya kuliko kunywa, kwa hivyo unakunywa tena. And sasa una overdose. Yeah. So people who have such problems, particularly if they're using pills, we encourage people to use a pill organizer. Unaweka dawa zako kwa ile pill organizer. So kama umekunywa, hata utaona tu. So inakuanga imeandikwa Monday, Tuesday, Wednesday. Na Monday kuna morning na evening. Ama kama unakunywa saa 6 pia kuna midday. Sasa ukifikiria ukisahau kama ulikunywa asubuhi on Tuesday, ukienda kwa Tuesday unapata dawa hakuna. Hivyo ulitumia. Yeah. So
and for insulin users, because kuna mara tunatake mara mbili, especially long acting. So remember kuweka nini alarm. Kiweka alarm udunge, check mahali nimedunga leo.
I had an experience.
It helps.
Nikadunga long acting, unaenda unadunga short acting, alafu unadunga
Long acting unadunga tena.
So you should have a sort of a record.
Yes.
Also, not knowing, forgetting to take meds, you can use the alarms. Everybody has a phone now. Unaweza tumia alarm. Pia kwenye hospital setting, there are very many areas where you can get hurt. But we encourage healthcare workers working in concert with us to minimize and mitigate and even where possible eliminate all potential for harm in these settings. Again, hata hospitali sio ati lazima unaweza pata harm kwa kitu daktari amefanya. No, it can be slippery floor and our patient who is weak falls. We have had cases of patients getting lost in hospital. We have had cases
emergency sectors unafaa kwa nazo, si ndio?
Yeah.
Kama mtu diabetic, you don't expect me nipange line for like 4 hours na our patients wengine.
Yeah.
That's also a safety measure.
But how will they know you are diabetic?
We normally have lists.
Yeah.
Pia unaweza jiongea.
Unaweza jiongea. You can be, wearing an armband which says, but then the same way you're saying about standard information, that armband should be recognized. Mtu akiona tu anajua huyu ni. Kama vile mtu akiona hii yangu anajua aje. Mnavumilia kuwa Mkenya. Now this is known worldwide as a sign for a Kenyan. So it's an important day, and we'd like to encourage everyone to, feel as part of the solution for patient safety. And like who said, everyone is a patient at some point in time. Yeah. Either you are a patient now or you are a potential patient. Yes.
So unaweza tukafunge. Parting shot remarks. Ama inaitwa parting shot what? Take home messages. Hiyo.
Mrembo na kutuambia kama kosoka ama ametoka.
Ayuko Josephine ni kosoko. Okay, mnaje message ya kwenda home.
My parting shot is to people, to us type 1s, we get stigmatized a lot. So when people stigmatize you, try as much as possible to compose yourself and just try and educate them about type 1 diabetes. To people out there who think type 1 diabetes is communicable, it is not. When you hang out with me, you cannot get type 1 diabetes from me, and treat us as like other people. When we are working, we also want to feel like other people. We do not want to feel like, oh yeah, she has type 1 diabetes. Do not give her that job. Give us those jobs. We like challenges, and we also want to feel like part of the community.
Big on.
Yeah.
As type 1, it doesn't mean that it's the end of the world. Yeah, I'm okay. I can hang out with everyone. I can do anything that you guys can do, like activities. So when you hear I'm type 1 diabetic, don't feel that I'm out of the world. Yeah, just respect us. We are there, and we are there to enjoy our life.
Thank you.
Yeah.
Mr. John.
Thank you. I think just to say that Global Week for Action is running up to Thursday, September 21st, and I'd like to encourage as many people as possible to participate, share their messages, and say what they would like to see done, or what they can do themselves. You can find more information if you go to any website, any browser, and type Act on NCDs. It will take you to the Global Week for Action, and you will see a section of Take Action, and it can direct you on how you can act. You can share, you can record a message, or you can record yourself on video and share that message in what we call the map of impact.
Or upload a photo.
Or upload a photo. And also, if you go and in your social media handles, Instagram, Facebook, and TikTok, and look for hashtag the moment for caring. It will guide you on how you can now post a message for Global Week for Action.
So for me, what I can say is creating a healthy environment requires a teamwork, and we should all be team players. When we talk about us, what are you doing to prevent NCDs? What is the government doing in terms of capacity building for our employers, affordable and accessible medical supplies? What is our health workers doing in terms of proper service delivery? Are they doing out of wholeheartedly, or is it something they want to do in terms of by the way? Like, let us all be a team. Let us all be team players, so that everyone should try and create a healthy environment.
For me, kila kitu imesema with my guys here, and so I would like to say thank you to NCDAC for sponsoring this video, to our hosts, our hosts, the owners of the studio, and our videographer, that is the Outgrown Enterprise, and also you beautiful and handsome ladies and gentlemen for making time to come and chapa ikitu. So until next time, guys, don't forget to like, subscribe, share, and comment down below. The hashtag is, what is the hashtag? GWA, NCD Alliance, and gapping the care gap.
Bridging the
care gap.
Kizungu is not
Kizungu. Anyway, bye guys, until next time, adios.
Okay, bye.
Bye. Thank you.